Welcome. In this framework that I'm going to present to you, it's going to be a way that you can systematically evaluate ALT in your patients. So if you have a chemistry that you get back on a patient and you see that an ALT is high, do you ever go through this in your mind where you're wondering, what should I do next? Like, is this high enough where I need to treat it? Do I need to recommend an ultrasound today? Or should I just have this patient come back in a month and then sort of monitor it instead? So the goal of this presentation is at the end, you're going to have a more systematic way that you can think through an elevated ALT in your patient and have a way to come up with next steps that make you feel comfortable with managing that type of situation. So we're going to start with, what is ALT? ALT, as you may know, is an enzyme that's in the cytosol of hepatocytes. And so when those cells are damaged, the ALT will then leak into the bloodstream, and you can measure that on your blood work analysis. And so when you see that ALT is high, it means that liver cells have been injured and have been leaking this enzyme. Unlike ALP, which is an enzyme that actually lives on the hepatocyte membrane, ALT lives inside. So what ALT is not is, it is not a liver function test. And so it just tells you liver cells are damaged, but it doesn't tell you that liver function has been compromised. And in order for actually the liver to not function well, it takes a lot of hepatocytes to be damaged. Roughly 70% of your liver has to be damaged in order for you to lose liver function capability. So what are the things that measure liver function? Well, there's a number of things, and the things that measure liver function are albumin, which is made by protein synthesis in the liver. Glucose is made as well by the liver through gluconeogenesis and storage of glycogen. Bilirubin is somewhat of a measure of liver function because it measures how well the liver can uptake, conjugate, and excrete it. BUN is a measure of liver function, so it's part of the formation of urea. Cholesterol is also a measure of liver function, so the liver synthesizes cholesterol and metabolizes it. And then bile acids, as we know, is the main way that we can monitor liver function. So when we're looking at interpreting liver values, we do want to keep in mind whether the patient is a dog or a cat, because they are a little bit different in regards to how you're evaluating their liver enzymes. In dogs, ALT is their dominant enzyme for identifying a primary parenchymal liver disease, versus in cats, they usually get biliary-centered liver diseases when they have primary liver disease. So instead, for cats, ALP and GGT are the most meaningful indicators of primary biliary disease. The other major thing to keep in mind with dogs and cats is that the ALT half-life in dogs is quite long. It's 40 to 60 hours. And because those elevations can persist for days, what matters is the magnitude of their elevation and also the trend over time. Versus in cats, the half-life of ALT is only 6 hours. That's a fraction of what it is for the dog. And that means that if you have an ALT elevated at all in a cat, even mildly, that means injury is happening right now. And so it gives you more pressure to investigate an ALT elevation if you're looking at a cat versus in a dog. And then when you are seeing an ALT elevation, keep in mind that after acute injury, the values for ALT will peak at 24 to 48 hours, and then they normalize over the following 2 to 3 weeks if that insult resolves. So now we're going to talk about what causes ALT to rise in the first place. So when ALT is the dominant enzyme that's elevated, meaning that your ALT is higher than your ALP, you're looking at what we call a hepatocellular injury pattern. So you're thinking of things like active or chronic hepatitis. You're thinking of things like hepatic necrosis, and that actually gives you really high ALT elevations That can sometimes be 100 times the normal value. You're also looking at hepatotoxins. There's a lot of those. They are things like xylitol, NSAIDs, azathioprine, acetaminophen, certain mushrooms, sago palm, aflatoxin, and blue-green algae are all examples of hepatotoxins. Also thinking of infectious diseases, namely leptospirosis in the dog. Vacuolar hepatopathy also happens in dogs. Neoplasia, whether it's primary or metastatic neoplasia. And then in cats specifically, you're looking a lot at hepatic lipidosis and cholangiohepatitis. And if we're thinking about portosystemic shunts, we do want to keep in mind that they actually have surprisingly mild liver enzymes, and ALT is considered one of the less sensitive tests or indicators of a shunt in a dog. Some studies have shown that less than 50% of dogs and 20% of cats will even have an ALT elevation if they have a shunt. So a normal or just mildly elevated ALT will not rule out a portosystemic shunt. Clues that you would want to look for instead are if you have a young patient, do you see a small liver on imaging? Do you see a low BUN, a low albumin? Do you see anemia with microcytosis? And then, of course, are your bile acids elevated? Those are all better indicators of a liver shunt. So what to do next? When you see an elevated ALT, a good approach is to, in dogs at least, stratify into mild, moderate, and severe elevations. So a mild elevation is something that's less than 3 to 5 times the normal range, and those commonly come from non-primary liver diseases. So you're thinking of things like Cushing's or steroid use, diabetes, pancreatitis, and GI disease can all cause those milder elevations. And then in cats, hyperthyroidism is what typically causes the liver enzyme to increase. And then those improve once that hyperthyroidism is treated. And then for moderate elevations, we're looking at 5 to 10 times the normal range. And those tend to be hepatocellular injury. They can be things like chronic hepatitis, early acute hepatitis, hepatotoxins, biliary disease, hepatic neoplasia, infectious disease, and also hypoxic injury to the liver. And then finally, when you have marked liver enzyme elevation, that's going to be about 10 times the normal range or higher. And that suggests something like acute hepatic injury or necrosis. And you want to prioritize acute hepatitis, toxins, something like ischemic or hypoxic damage to the liver, or really severe inflammatory disease. So any elevation in a cat, don't wait to investigate, because that short half-life does mean that even a mild number reflects some active ongoing injury. And again, like I had mentioned earlier, hyperthyroidism is a common cause of ALT elevations in cats, and it does improve once that hyperthyroidism is treated. So a clinical algorithm that you can use for dogs is following this sort of treatment plan or diagnostic plan. So the first step is, when you see an ALT elevation, ask yourself, could this be due to a drug or toxin that the dog has been exposed to? And if the patient is on any medication that could have hepatic effects, like an NSAID or azathioprine or some kind of toxin exposure, you want to try to discontinue that drug, if it is a drug, and treat for hepatotoxicity if you can remove something that you think is causing it. The second step would be to ask yourself, is the dog feeling well? Because if the dog is looking clinically normal, meaning you don't see any signs of weight loss, there's no vomiting reported, no diarrhea reported, no decreased appetite, and that you see an elevation is mild, less than 2 to 3 times normal, you can try treating them first with an antioxidant, something like denamirin, and then recheck the liver value in 4 to 6 weeks. But keep in mind, if the dog is under a year of age, you may want to start an empiric deworming medication just in case, and then also consider running a bile acids as well at that point to investigate a liver shunt. Now for step 3, if your dog is instead showing clinical signs, So they don't feel well, they have some abnormalities going on. First, find out if you think that there is any evidence of muscle disease. So you're looking for weakness, signs of muscle wasting or stiffness. And if you do hear that from the owner or notice that on the exam, you want to make sure that you take a look at the CK and AST if it's not already on your chemistry panel, because although ALT can rise with muscle damage, AST and CK are far more specific for a muscle-related cause of ALT elevation. And at this point, you want to run a full CBC and chem panel and a UA, and you're going to evaluate for extrahepatic causes based off what you find. So things on your list are going to be things like endocrine disease, like Cushing's or hyperthyroidism, GI disease, pancreatitis, systemic infections like leptospirosis. You're going to look at hyperlipidemia and cardiac disease. So if you rule out extrahepatic causes and ALT is still elevated or it's progressing, then it would be an indication that you should go a step further. And that next step is typically you're going to want to do imaging of the liver with an ultrasound. And also, if you haven't already, do a bile acids test. So if the bile acids are abnormal, then you're committed to looking further and doing some more investigation. And those kinds of things would be like fine needle aspirate or full liver biopsy. You wanted to get histopath with special stains. You could do a bioculture. You may want to do heavy metal quantification. Those are all things that you want to do potentially if you see, something abnormal with your bile acids. And then imaging results can help you look for things immediately, like you may notice an anatomic or vascular abnormality, like a shunting vessel. You can also see signs of things like regenerative hyperplasia, fatty liver disease, or you might notice that there's a biliary mucocele present, or even signs of neoplasia. So overall, some of the common findings for primary liver disease would be things like regenerative hyperplasia, reactive hepatopathy. You could have, of course, hepatic neoplasia. You could have chronic hepatitis or cholangiohepatitis. And also you can have idiopathic vacuolar hepatopathy. You can have portal vein hypoplasia or a shunt. And you can have biliary disease like a mucocele. And that's where you'd expect to have an ALP greater than your ALT. So the takeaway from this algorithm is that you want to do a stepwise approach, and that will help you evaluate your patient more efficiently. And you won't necessarily have to do all this over investigating with every incidental finding of an ALT elevation. Keep in mind, ALT is a leakage enzyme. So in summary, it tells you injuries happening, but not how bad the underlying disease is. And dogs and cats are different when it comes to interpreting the relative elevation. And primary liver disease, shunts, and secondary causes should all be considered. So your next steps depend on the magnitude and the elevation, and also whether it's a dog or cat, and also if they feel well or if they feel sick. So you hopefully will avoid over-investigation, but also be doing your due diligence when you see an ALT elevation. And this is a summary page, and I hope that this was helpful for you. Thanks for watching.